The information you will listen to in this video has been prepared by making use of the package insert of the drug. If the video is useful for you, please like the video and subscribe to the channel. Belonging to a class of drugs called antiemetic agents, Diclegis active ingredients are Doxylamine and Pyridoxine. Doxylamine is an antihistamine that is thought to work by affecting certain natural substances in your body or by acting directly on certain parts of the brain. Pyridoxine is a B vitamin that is important for good health. Most people get enough pyridoxine in their diet, but certain health conditions can result in a lack of this vitamin. What is Diclegis and what is it used for? This combination medication is used to prevent or reduce nausea and vomiting caused by pregnancy. Decreasing nausea and vomiting may improve your health and nutrition during pregnancy. How to use Diclegis? Take this medication by mouth without food as directed by your doctor. If this medication is taken with food, it may take longer for it to start to work but will not decrease the effect. Swallow the medication whole with a full glass of water. Do not crush, chew, or break the tablets. Dosage is based on your medical condition and response to treatment. This medication is usually taken at bedtime to decrease nausea and vomiting in the morning. If nausea persists during the day, additional doses may be prescribed by your doctor. Talk with your doctor about your symptoms and the best dose schedule for you. Do not take more than 4 tablets in a day. Do not stop using this medication or change your dose without consulting your doctor. Some conditions may become worse when the drug is suddenly stopped. Your dose may need to be gradually decreased. Use this medication regularly to get the most benefit from it. To help you remember, take it at the same times each day. Things to know before using Diclegis. Before taking this product, tell your doctor or pharmacist if you are allergic to Doxylamine or Pyridoxine, or if you have any other allergies. Diclegis use is not recommended if a woman is concurrently using central nervous system depressants including alcohol. The combination may result in severe drowsiness leading to falls or accidents. This product is safe to use during pregnancy. Pyridoxine passes into breast milk. It is unknown if Doxylamine passes into breast milk. However, similar drugs pass into breast milk. Doxylamine may have undesirable effects on a nursing infant. Consult your doctor before breastfeeding. Side effects that may occur with the use of Diclegis are drowsiness, dizziness, blurred vision, stomach upset, diarrhea, constipation, headache, and trouble sleeping may occur. Remember that this medication has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. If this video was useful to you, like the video and subscribe to the channel. Verify your views and experiences in the comment section. I wish you healthy days.